So friends, in continuation with the child therapeutics, the fourth part of the video, let us start with some drugs which are very rare and very sparingly used in a practice in child therapeutics. The first drug that comes to my mind is Arum triphylum. Yes, Arum triphylum. I had a case of a child where the parents complained that the child does not eat food. Not because that he is not hungry, because he has pain in the mouth. He has the mouth is all with the mouth is very sore, and he cannot take anything inside. He had gone to other doctors, but all the tests were normal. The doctor gave something to apply. Till the time he applies, he feels better, and again he's back to square one. He's not eating food properly because he has pain in the mouth. So whenever this type of patient comes to us, the first drug which we think is mercury. But my friend, if next time the patient comes to you, think about Arum triphylum. It is very beautifully written in Materia Medica that child refuses food and drink on account of soreness of the mouth and the soreness of the throat. Very similar to Merck salt. But of course, Merck salt has a different symptom of perspiration and then excess salivation, something different. But in Arum triphylum, that child was given Arum triphylum 200 single dose, and the fourth day the parent came to me and said, "Doctor साहब, अब वो खाना खा रहा है, अब उसको तकलीफ बहुत कम हो गई है, 80% ठीक हो गया है। इतनी दवाई हमने खाई एलोपैथी की, बाकी सब दवाई ट्यूब लगाए, इतना फर्क नहीं पड़ा जितना 4 दिन में फर्क पड़ा है." So this is the magic of homeopathy. This is the magic of interpreting the symptoms written in the Materia Medica properly and accurately, so that a prescription does not fail. That is the Arum triphylum. One more symptom which will help you to differentiate Arum triphylum with mercury is sleeplessness. Arum triphylum children have sleeplessness. So in short, just remember two symptoms of Arum triphylum. Child refuses food and drink on account of soreness in the mouth and soreness in the throat and sleeplessness. Of course, for comparison, you can think about other drugs like Merck salt, which comes very close to Arum triphylum. So this is in short about Arum triphylum, what I have seen in the practice. There are many symptoms. You can go home and always read. Next drug that comes to my mind is Bryonia alba. Now in Bryonia alba, there are, if you see the Materia Medica of Bryonia alba, aggravation from motion, better by rest, dryness of skin, thirst for large quantity of cold water at long intervals. This is there. But what is more important in the child therapeutics in Bryonia is children's dislike to be carried. This is a very important symptom. Children's dislike to be carried or to be raised, because a child wants rest. He does not want to move. He always wants to stay silent, because motion aggravates and rest emulates in Bryonia album. This is how you must interpret a child in Bryonia, or this is how you must interpret Bryonia album. That is, child dislikes to be carried and the child dislikes to be raised. Simple Bryonia album. With constipation, stool hard, dry, as if burnt, thirst for large quantity of cold water at long intervals. This is Bryonia album in short, which I am telling you. Again, a drug which is a very short drug I have used in a practice, one line symptom, that is stammering children's. Whenever you have stammering children, the first drug that comes to our mind is stramonium. But always think about this drug also if you have stammering children's, and the drug which I am talking is Bovista. Yes, Bovista also has this symptom, stammering children's like stramonium. And in Bovista, you must always think about tertiary eruptions on the skin, tertiary eruptions on the skin. That is a very important symptom of Bovista. And on face, if you get a lot of pimples because of abuse of cosmetics, then also Bovista is indicated. Nowadays, we have a lot of cosmetics, face washes and creams and lotions and under eye gels, where the parent uses for the child to make the child glow, and because of that abuse, lot of use, then it becomes abuse. So if there's abuse of use of cosmetics and the patient's face has acne, pimples or any other symptom of the face because of abuse of cosmetics, you must think about Bovista. So these are drugs which are very rarely used, but if the symptom corresponds, then nothing like Bovista. Next drug you must think about that comes to mind is Sambucus nigra. Now Sambucus nigra has many symptoms in children's, but what I have seen important and what I have seen in my day-to-day practice, the symptom which I have seen, I'll narrate those symptoms to you. That is adapted to diseases of scrofulous children, which affect the air passage. In Sambucus nigra, the affection of the air passage is the most important symptom. That is Sambucus nigra. Dry coryza of infants. Now what do you mean by dry coryza? Dry coryza matlab the nose is completely dry. Imagine that your nose is dry. How will it feel? It is obstructed, preventing breathing. मतलब सांस ले पूरा इतने नोज ड्राई रहती है कि सांस भी ले नहीं पाता, और बहुत छोटा बच्चा रहा तो वो नर्सिंग भी नहीं कर पाएगा, मतलब दूध भी नहीं पिएगा माँ का. That is the important symptoms of Sambucus nigra child. The nose is so dry, it feels obstructed, even the nursing is difficult. So you must think about two drugs if the nursing is difficult in dry nose. That is, first is ammonium carb and second is Nux vomica. These two drugs also have the same symptom, dryness of nose and difficulty in nursing. Now dyspnea. The child awakens suddenly in night, suffocated. ऐसे सोए रहेगा बच्चा, उठ जाएगा घबरा के, सांस फूलते हुए. That is Sambucus nigra child. It will be beautifully explained by the attendant who is sleeping, or the parents, or the siblings of the child कि ये घबरा कर रात में उठ जाता सांस फूलते हुए. ऐसा तो क्या हो गया, कुछ बुरा सपना देखा क्या? ऐसा कुछ नहीं है Sambucus nigra में. Sambucus nigra wakes up suffocated, the face is livid, turns blue, has to sit up in bed. ऐसे नीला पड़ जाता है, बिस्तर बैठना पड़ता है. He in fact gasps for breath. सांस उसको नहीं आती तो gasping करता है because of breathing, which finally settles down. Attacks passes off, but is repeated again and again. That is a Sambucus nigra dyspnea. It is written beautifully in Materia Medica, a 3 marking symptom, black letter symptom or a red line symptom of Sambucus nigra. That is, child inspires but cannot expire. Child inspires but cannot expire. You must think in this symptom two drugs. One is chlorine and second is mephitis. Mephitis and chlorine also has the same symptom. Child inspires better but cannot expire. So a Sambucus nigra child, dyspnea, wakes suffocated at night, gasps for breath, has to sit up, turns blue, and then you feel when the attack passes off, it is repeated again. That is Sambucus nigra. Can inspire but cannot expire, like chlorine and mephitis. One more symptom, sleeps into the attack. Whenever these symptoms come to your mind, or patient tells you sleeps into the attack, the first drug that comes to our mind is lachesis. Of course, lachesis is a very important drug, but my friends, always think about Sambucus nigra also, sleeps into attack. So these are few drugs which as remedies which I have told you in this video. Go home and read again. In the next video I'll add few more drugs. Thank you.